Welcome to Three Thoughts On. Today I have a very special guest, Dr. David Fajgenbaum. David, how are you today?
Doing great. Thanks so much for having me on today.
Thank you for making the time for me. I know you're busy doing amazing things that I cannot wait for you to share with our audience. But first, I'd like for you to, you can take a couple of minutes and give us a little bit of a background on who you are and what you do. And then we can get into the meat of some of the work that you're doing that hopefully will be benefiting millions and millions of people worldwide.
Sure. I am a physician scientist at the University of Pennsylvania. I run a center here focused on inflammatory diseases, and we work to try to repurpose drugs to treat these diseases. And I first got into this world when I myself became a sick patient with one of these horrible inflammatory diseases when I was a medical student. And I ended up discovering a drug that could be repurposed to save my life, a drug that wasn't made for my disease, but we figured out it could be repurposed. And so that has led me to launch this center at Penn, but also to launch an organization called the Castleman Disease Collaborative Network, focused on Castlemans. And finally, about a year and a half ago, to launch a whole other nonprofit organization called Every Cure, which is on a mission to unlock every possible use for every FDA-approved drug, because we don't believe patients should suffer if there's a treatment that could potentially help them.
Well, that's that's a very quick summary of a very long career and life, that you've been, at least from what I know. So just for the audience, I met David here 2 years ago at in Lake Nona at the Impact Forum, and I have to say, for those people who don't know what the Impact Forum is it's an event that we do here in Lake Nona that is packed with amazing people that are doing amazing things all over the world. And your talk was by far the best for me that year.
Wow,
Uh, it,
thank
it,
you.
it my father is a physician. He's retired now, so I'm very close to my heart all things that are about good medicine. And to hear your story and how you survived and how you kept fighting and now how you're doing all this work, it's inspiring. It's inspiring. So I thank you for that. I wanna get into a little bit of this topic of inflammatory diseases because, yeah, I'm not a doctor. I'm just a student of science. I'm an engineer by
Mhm.
school. But given my background, my mother was a professor of a university professor and a lawyer, and my dad is a retired physician. I've been very close to science and science being put to good use, right? And one thing that I'm noticing is more and more this onset of things that are derived from inflammation.
Yeah.
So, can you give us a little bit of context there when we talk about inflammatory diseases? What are we talking about here, and why should people care?
Sure. We're talking about diseases where the immune system is involved in a way that it shouldn't be. You need your immune system and you need inflammation for a few purposes. One of those purposes is to fight off infections. So, if you were to get COVID or the flu, you better have your immune system in place. And inflammation is one of the ways that your immune system fights that thing off by producing inflammation, by releasing cytokines. That helps to kill the virus. It helps to put the bacteria at bay. And then it's supposed to go back into a watch and wait mode. So that's one of the reasons why you have an immune system. Another is to surveil against cancer. So if a cell in your body becomes cancerous, if it's transforms into cancer, your immune system needs to notice that cell and then generate an inflammatory response, so inflammation, to kill that cancer cell and then go back into surveillance mode. So those are really the two main roles of your immune system. But for some reason, and in many cases, it's multifactorial. Your immune system may get involved in other ways that it's not supposed to be, and it may produce inflammation when it's not needed. When that inflammation isn't helpful for killing the virus, it's not helpful for killing cancer. It's just causing problems. And so, inflammatory diseases are when you have more inflammation than is helpful for whatever you're dealing with, and it's what we call pathological inflammation. And so that's where generally you need to have some sort of intervention. You need to quell the inflammation with a drug, or you need to change some sort of lifestyle so that way you can get the inflammation under control.
And just for completeness here for the audience, I think if you ask the average person, to define inflammation. They associate it with the type of inflammation that takes place as a result of a physical injury. You twist your ankle and your
Mhm.
body immediately swells up. That is entirely different than what we're talking about here. You want to expand on that a little bit?
Sure, absolutely. It's entirely different, and at the same time, the cells that cause the inflammation when you hurt your ankle, it's many of the same cells that cause inflammation throughout your body for a variety of reasons. But to your point, very, very different. So, in the same way that your ankle swells up because you twist your ankle, it gets red and hot to the touch. That's because there are a number of what are called cytokines or prostaglandins that are produced. That's going to help to heal the area, increase blood flow. That's why it gets swollen. Well, when you have an inflammatory response in any part of your body, if it's your lungs because you have COVID, or if it's your abdomen because you've just gotten a stomach virus, you're going to get the same sort of inflammatory response. You're going to get some swelling in the area. It might become hot because there's increased blood flow. And so inflammation is sort of the same all over the body, but the reason behind it, again, sometimes it can be really good. Like when you hurt your ankle, that inflammation is really good. It's going to help you to heal your ankle injury much more quickly than if you didn't have the swollen inflammatory ankle. But sometimes you get a swollen ankle because of you have rheumatoid arthritis, and that's not for any good reason. That swelling is not good. And so, like, sort of everything that your body does, there's usually a good use for just about everything your body does, but sometimes that exact same thing that in some cases could be good could actually be bad in different scenarios.
And also for how long, right? Because
Yep.
it's just kind of analogous to to cortisol levels going up. That in itself, just by itself as a single event, is not necessarily a
Yep.
bad thing. But if they stay up for extended periods of time,
Yes.
then that becomes or could become a serious problem. So when it comes to inflammatory diseases like the ones that you suffered from, how does that manifest in the body? And I know that we're still learning a lot about these things, which is why you're doing the work that you do. But for the average person that's out there, working 9 to 5 or maybe working two jobs or just trying to make it, what kind of things can you share with the audience that would help people identify if some of these things are happening already within themselves and they just don't know?
Yeah, it's a great question. So, the kinds of diseases that I study are the ones that are very overt inflammation. So, someone ends up in the intensive care unit because their liver and their kidneys and their bone marrow are shutting down. And it may be for an unknown cause, like occurs in Castleman disease, or it may be because they have sepsis because of a bacterial infection in their blood. So, I study the really overt causes of hyperinflammation, where it's just like your whole body is in shock because of this inflammatory response. But to your point, there's sort of all levels of inflammation. And so, there's points where you're not in the ICU because your organs are shutting down, but there's sort of low grade chronic inflammation that may be at play. Maybe you're more fatigued than usual. Maybe you're just feeling achy and unwell. Inflammatory diseases are being diagnosed more and more frequently than ever before. And so, if you're having symptoms, you're more tired than usual, you have some joint pain, you feel sort of what we call malaise, or you just feel unwell. Those are the kinds of things that it's good to talk to your doctor about. But again, it's probably not one of the diseases that I study, because the diseases I study, that you've got the problem because, all of your organs are shutting down.
So in your case, there was a point in your life, you were a student, you were a football player,
Yeah.
you for all accounts and purposes, everything was going great. And then it wasn't. For you, in your case, with your experience, was that a abrupt change from being well to not being well? Or looking back, could you identify that it was probably more of a gradual thing that maybe went unnoticed for a while until it wasn't ignorable anymore?
It's a great question. As you said, I was a third year med student when I got sick. So I was sort of pinnacle of health. I'd played college football. I continued to exercise and eat really well, and was very, very, very healthy. And what seems to be very abruptly became very ill. In hindsight, I was probably drinking more cups of coffee and more Red Bulls than I probably ever had in the weeks leading up to it. So I probably was having some greater fatigue than usual. But as a medical student, we don't sleep very much in medical school. We're sort of always getting pushed to our limits. And so at the time, I didn't really think too much of how tired I was. But yeah, it got to a point where it really exploded. And I went from this healthy medical student, literally had just delivered my first child into the world because I was on an OBGYN rotation, to being in the ICU with all of my organs shutting down in the exact same hospital, having a priest reading my last rites to me, my doctors telling me that I wasn't going to survive, and having to hug my family goodbye in a matter of weeks, right? From total health, delivering children into the world, to literally dying in the ICU. And so it was very abrupt for me. And of course, I never would have dreamed that over 13 years later, I'd be sitting here talking to you in a good state of health, and talking about how we've gone from not just identifying a drug that could save my life, but actually creating a system and identifying many more drugs to save other patients' lives.
So I want to zoom out on that for a moment there, because so let me postulate something to you, and then you tell me if I'm off in left field or if there's some level of certainty or truth to what I'm saying. But there seems to be this movement these days. Just like this podcast. There's tens of thousands more. Most of them with people far more qualified than me. Right. So you have
no,
the yeah, you have the Hubermans, you have Dr. Hyman, you have everybody doing all kinds of wonderful work, right? And there seems to be this movement that if you're healthy, if you exercise, if you do, there's like the basic fundamentals, right? If you're eating well, meaning nothing that is overtly dangerous for the body. If you're moving every day, if you're meditating and maintaining the stress levels below uh where they should be, that the body becomes an ecosystem that is conducive to healing, and it is now in a position where it can tackle most of anything that comes after it, right? But yet every once in a while you hear an example like you. Yeah, you took care of yourself. You're a
yeah,
college athlete. I'm
yep,
assuming, please correct me if I'm wrong, no history in your family of any kind of
sure,
problems, and yet you go from that, which, again, correct me if I'm wrong, but that cannot be attributed to the stress of med school, right? Because
no.
you
A
know,
lot of people go to med school and don't
e-
get sick
e-
like that. Yeah.
exactly. So you go, and this is so quickly, right? So what is at play here? Because I'm sure I know I'm asking a very difficult question that probably there isn't an answer to, but for those of us who have made significant changes, I've made significant changes in my life in the past 10, 15 years, because personally I've seen loved ones. Like, I lost my mother less than a year ago to
Mhm.
cancer, right?
So, yeah.
And I've seen other relatives, and you see friends and family go, and I got it in my head that I have to do everything I can to minimize the risk of falling ill in some way, form, or fashion,
Yes.
right? And I do see that I am stronger than I've ever been. I'm healthier than I've ever been. But then again, tomorrow can be different. Something may be
Yep.
at work, completely unbeknownst to me, completely unnoticeable, and then it could be again like you, ICU, last rites,
Yep.
and then who knows, right? So can we kind of, I know that's not a question, it's more of a statement there, but
No, it's an important
is there
point.
some truth there? And then how should we observe all of that in a holistic or healthy way, so that we're not terrorized by the thought that it doesn't matter what I do, I may just be having something right now that's going to kill me tomorrow?
Totally. These are all the right questions to be asking. I mean, from my perspective, I think that doing all the things you described are absolutely the right thing to do. Eating the right way, exercising the right way, reducing um, uh, behaviors that could increase your risk of disease, or the things that we should all do. And but the important thing to remember is that the term risk. And so doing all those things reduce your risk of illness, reduce your risk of disease, reduce your risk of harmful things happening, but they don't eliminate the risk of these things, right? And so there is no way to completely bulletproof your health. And the reason for that is that there are subtle differences in our DNA from one person to another that strongly increase our risk of one thing over another. So that one person who maybe does everything to lower their risk, they maybe already had a 300-fold increased risk of that thing. So even though they did all the right things and they reduced their risk maybe 100-fold, they started out with a 300-fold increased risk just because of a subtle change in their DNA, or maybe because of some exposure that they had at some point in their life. And so I think the important thing to do is to know that we should always be lowering our risk, eating well, exercising, again, improving lifestyle choices that lower risk. But we also have to remember that that it's still risk, which means there's still a chance that those things happen. And that's why it's important, to seek out the medical care that you can if and when those things do happen. And it's why we're working so hard with this new initiative I mentioned called Every Cure, to make sure that every drug that's on the pharmacy shelf for one disease, that we also understand all the other diseases that could potentially benefit from that drug, so that if you do have one of those diseases happen to you, despite all the work you did to lower your risk, that we make sure that there's a drug that can be given to you right away, so that way you can benefit from it.
Oh, that's great. Well, let's zoom into that Every Cure initiative. This is relatively new, right? Is
That's right.
2022, if I'm not mistaken. But the the understanding that I have is that through your journey and through your work, you are basically looking for ways of taking drugs that maybe are generic, that have been FDA approved for A, B, and C, but through some sort of correlational analysis, artificial intelligence, machine learning type of models, that you can find out that maybe they will work for X, Y, and Z. Am I
Yep.
oversimplifying this? And if not, can you please expand on it?
You said it perfectly, and the only thing that I would add to it is that yeah, we're looking at all 3,000 FDA approved drugs, and we want to figure out what other diseases could those 3,000 drugs treat other than the about 3,000 diseases that they currently treat. The only thing I would add is that yes, we're discovering new uses for them, but we're also just uncovering new uses that someone else has already discovered. And so it's sort of hard to imagine this, but there are drugs that are on the pharmacy shelf at CVS where a brilliant group of researchers has already discovered that that drug could be useful in another disease area. Another disease could benefit from that drug. But because the drug is generic and therefore not profitable, so once a drug becomes generic, generic manufacturers can make it for pennies a pill. Because it's no longer profitable, no one will do the work to prove that that drug works in that new disease, and then also make sure that it's available for patients with that disease, because you can't make any money off of a generic drug. And so there are literal amazing examples, like a drug called arginine, very inexpensive. It's actually an amino acid, and the role that it plays in sickle cell disease, a devastating condition that people suffer from. Cheap, inexpensive nutraceutical could be life-saving for deadly, horrible condition, but because the economics don't add up, no one's doing the work to develop arginine for sickle cell. Or I should take that back. No one has been doing the work to develop an oral version of arginine for sickle cell disease. There is some work to do, an IV version of it. So the idea here is, let's use the world's knowledge to look for every one of those connections, all of those connections between things like arginine and sickle cell disease, or in my case, between sirolimus and Castleman disease. Or one of my favorite examples of repurposing is Viagra. We all know its current intended use, but what most people don't realize is that it wasn't initially intended for its current use. It was intended to treat a heart condition, and it was a side effect, erectile the reversal of erectile dysfunction was a side effect that was noticed. But what people also don't realize is that it is also used as a life-saving drug for a pediatric lung disease. So Viagra is literally saving lives of children that wouldn't typically have lived to even be a teenager. Now they can live full lives on Viagra, and that's because it's the same drug working in the exact same way, but it opens up blood vessels in the lungs for this horrible lung disease where the blood vessels were constricted. And so these sorts of connections that have already been made through the billions and even trillions of dollars of medical research that have been done over the years we're utilizing artificial intelligence to identify the most promising connections that already exist, and to your point, to discover new connections between drugs and diseases that maybe make sense based on how the drug works, how the disease works, but maybe humankind hasn't yet made that discovery. And so it's about looking at all drugs, all diseases, and then picking out the ones that look most promising, and actually doing the work to prove that that drug actually works in that disease, and to make sure the patients with that disease will actually benefit from that drug, and it won't just sit on the pharmacy shelf, and patients won't suffer while it's there.